Patients will be experiencing withdrawals.
Hey, good morning, folks.
Good morning.
Everybody hear me okay?
Yeah.
Yeah.
It's just a couple more minutes. Oh, I see Dr. Sellers is on. I think we're probably expecting a few more people.
Good morning.
All right, well, it is 7:31. I'm guessing some more people will probably come on in just a minute here, but just a quick announcement. Jamal is unexpectedly out today. He has some family stuff going on, so I'm gonna do my best to support Dr. Sellers in facilitating the meeting and walking us all through an exercise today, so that we can kind of get more information on what you all see as the biggest factors of change or risk or opportunity in our community with regard to healthcare. Bruce, I'll turn it over to you to kind of kick things off, and then we'll come back and get things started.
All right, thank you. Just like Justin said, our thoughts, our prayers, and all the goodness that we can send Jamal's way. Please, we're hoping for all goodness, for the best outcome for his family here. Today we're going to go a little old school, so please write in the chat box your name and the group that you represent for attendance today. That way we can mark attendance in this manner. We currently do not have anything to vote on with regards to shared savings. We were close, but then this emergency came up, so we will probably have multiple items to go through next time. And then our last announcement, but not least, I want to encourage everybody when these packets do come your way, before meetings, to please look through them a little bit, so that way we're hopefully a little bit not just only prepared, but we're able to participate a little bit easier. So that way we can facilitate these meetings, because we are trying to keep them down to our designated time frame. So with that said, Justin is going to lead us today in discussing forces of change for those who watched the 10-minute video from Tricia and did the survey. For those who did not, like Justin said, he's going to go through an exercise with us today. Reminder, I will be having to log off around 8 o'clock or in and out because of my patient load. And that if Naomi is here, she will close us out. If not, Justin will be the one to close us out today. So with that said, thank you. I see everybody is marking their names in the chat, and continue to do so, please, so we know your attendance and the organization you represent. And I believe I have once again spoken plenty for my liking. Justin, why don't you go ahead and take us away?
Thanks, Bruce. And please bear with us. This is our first time facilitating this process. Before we get started though, because Bruce just mentioned Naomi, Naomi's actually with some of our staff right now at the National NACHO conference, presenting on a rural health project that we all did in, that we all collaborated with in Falls City. So that's kind of an exciting opportunity for some health council staff, a county commissioner, and Naomi as the public health director. And then I don't know if folks saw the press release or not, but Naomi was also just selected to be the next public health director for the Oregon Health Authority. So that's a pretty big deal, and great opportunity to make sure that the needs of Marion and Polk counties are represented when statewide health policy decisions are made. So big deal. Well, good morning. I'm Justin Hopkins. I'm the executive director here at the Willamette Health Council. Alexia, you want to introduce yourself?
My name's Alexia Lopez. I'm a current intern for the Community Health Assessment.
So the Health Council has luckily partnered with Willamette University, and we've got 3 wonderful interns helping us with all of our community health assessment work this year. So Alexia is going to help us with our Forces of Change work this morning. So bear with me for a second. I'm going to share my screen and we will start this process. Maybe. All right, is everybody seeing our screen there? Hopefully.
Yes.
Perfect.
Yes.
All right. To get this started, I think what everyone needs to do, if you have your phone with you, it's probably the easiest way to do this, because we're going to ask you to scan that QR code. And then as we go along, you're going to enter information, and Alexia is going to work kind of behind the scenes to help collect that information and display it back on the screen so we can talk about some themes that we see emerging with the group. So if everyone wants to take a second, scan the QR code, and then maybe just give me a thumbs up when you're in.
I'm on the meeting on my phone. Is there a different link that can be put in the chat or anything?
Great question. There we go.
I'll see if, is it the same one that I think I have? I'll check. Actually, you start, Justin. Let's see if it's the same one I have.
We've got the info here. So if you want to pull this up in a separate tab, you can go to menti.com and then go 8602022 is the code. Is that working for folks? Lisa's got it, Angie's got it, Russ has it. I probably missed some thumbs up early on. I don't want to move on until everyone's got this part though. All right, Carlos has it. Carolyn, did it work?
Recording in progress.
I have it. It says waiting for presenter, so I assume that's correct.
Okay.
Minty
All right.
duck.
We're gonna move forward. Okay. First thing we need to do is we're gonna have everybody provide one word that describes your favorite thing about the Marion Polk region. And we're gonna see this start to populate as you enter your answers.
Do you have a favorite thing about Marion Polk County?
I think so. I went through this process with our THW Alliance last week. And I know a lot of folks put it the outdoors or something about nature, hiking, etc. I like how you're all thinking along the lines of your role on CAP and looking at collaboration and partnerships. So we've got the people, trees, diversity, collaboration, more collaboration, community partnerships.
Recording in progress.
All right. Everybody have a chance to put their one word? All right, we've got it captured. So that just gives you a little bit of an idea of how this is going to work. Okay. Next one, just asking some information about where you work and who you serve. So which counties do you serve? Marion, Polk, or both? It's like we've got a couple people that just serve Marion. Majority of people serve both. And are you in the meeting, Alexia? Do you mind providing the link again for Dr. Chaudhry there? All right, moving forward. Okay, so this is just a little bit of information on the exercise that we're going to go through today. We're going to look at really 3 different levels that are considered to make up the forces of change or the opportunities for change in the community. So we're going to look at trends, factors, and events that are occurring or that could occur that affect the health of our community. So social, economic, political, technological, environmental, scientific, legal, ethical. Think about things along all of these lines. I will say when we went through this last week with the THW Alliance, not everybody used like their professional healthcare lens as they were doing this. A lot of folks approach things maybe through a political lens or their family lens. I'm not going to tell you which lens to use. Maybe you might think about things through all of those lenses, but just remember that the context for all of these questions is our community health assessment. So I'll just leave it at that. So a little more information on the type of info we're looking for. Trends are patterns over time, such as migration in and out of a community or a growing disillusionment with government. Factors are discrete elements, such as a community's large ethnic population, an urban setting, or a jurisdiction's proximity to a major waterway. Events are a one-time occurrence, such as a hospital closure, a natural disaster, or passage of new legislation. So again, think big, think middle, think not small, but one time. All right, this is where you guys get to start playing. What emerging issues are affecting access to primary and behavioral health care? And and we'll give you a few minutes to respond, and then we'll take a look at what the answers look like. So emerging issues that are affecting access to primary and behavioral health care. Okay. Definitely seeing some themes emerge here. So workforce shortage, provider burnout, reimbursement challenges, a retiring workforce. Our workforce is not as renewable, underutilization of, I'm going to assume that that means peer delivered services, but I don't want to assume. VBP exists as aspirational. The trio of ACEs. So again, looking at maybe a more complex population to serve, lack of enough providers, more workforce shortage, and lack of information. Great. I think everybody responded. Anybody want to expand on what you wrote here? This is a good opportunity to interact.
I'll go first. This is Dr. Hatler. So yeah, and someone else mentioned too, unsustainable primary care reimbursement. So just a trend that we've noticed with Medicaid reimbursements is that they're not keeping up with cost of care. Ultimately, that's going to decrease access for patients and then lead to more ED visits and urgent care visits, which aren't good for the community.
Okay. So inadequate reimbursement leading to maybe workforce capacity, provider capacity, and ultimately that's just going to lead to people utilizing higher levels of care. Appreciate
Correct,
that.
yeah.
Anybody else? I'm just going to call on Phil. This is near and dear to what you do every day, Phil. What do you think?
Thinking I'm driving.
Oh.
I think it's a multitude of things. I think there's a lot of providers picking and choosing. I mean, I think sort of the reimbursement capacity is people are picking and choosing populations they can serve that have a lot more resources. I think the complex cases are utilizing a lot more of the higher end resources. I think we're probably about 4 years away from actually workforce capacity being where it needs to be, but that's a long ways away. So how do we trend that? And then I think COVID actually did a real number, particularly on the youth. People didn't get services for a couple of years, and so the services that are needed now for early intervention are pretty significant, and there's a lot of impairment. So I think we're still seeing some after effects of COVID in relations to a lack of services during that period of time, and then going forward, more complex cases.
Okay. Thanks, Phil. All right. We got a ton of information on this one. Thank you. I'm going to move forward to the next question. All right, so kind of back to the trends, factors and events. We're gonna ask, what are the driving trends in the Marion Polk region? So again, trends are patterns over time, such as migration in and out of a community or a growing disillusionment with government. What are the trends that you see driving change in the Marion Polk region? And again, this could be positive, it could be negative, but what do you see as the major trends? And I think you all have figured it out. You can put more than one answer. So legislation at state and federal level, I've heard that come up in other forces of change exercises as well. Growing urban population in Salem, underutilization of peer delivered services. I don't know who's writing that, but I appreciate that theme being woven through. That's great. Political friction, I've seen that come up as well. Rural areas getting poorer, so maybe like the divide is getting worse between rural and urban areas. Change in Medicaid provider. I'm not sure if that's referring to healthcare provider or the CCO. Both could be true. Economics, supply and demand are inversely correlated. Increased migrant population, expansion of Medicaid outpacing provider recruitment and retention, along with declining reimbursement. The Bridge program coverage and Healthier Oregon coverage, so the expanded Medicaid population in Oregon. New OHA leadership and strategy, as well as governor. Significant influx and rapid decline in public health funding after the pandemic. The reduced behavioral health workforce post-COVID. Public services struggling, such as the school district. Not enough spaces, places like this. Increased need for medical and behavioral health care and unintended consequence of state rulings. Cool. Alexia just informed me that we're now going to get to vote on which things are most important to the group. Oh. Does that mean I need to go back? Because we're moving on to events.
It's the same.
Bear with us just a second here. I'm going to assume it would click on this.
Yeah.
Vote.
Yeah. So we want to make sure that we're not voting on multiple that are similar. So we want to make sure that we're getting a variety of top 3 choices. So if you see some that are kind of repeats of each other, just try to find another one that you would consider to be in your top 3.
So we'll collect themes basically.
Mhm.
Okay. Are you guys all seeing an opportunity to vote? hopefully.
I see the topics listed, but it seems like you can't click on them or anything.
Uh-oh.
I'm getting two.
Is that better?
Mine just went back to
Yeah.
intern.
Oh, here we go.
It
Now
went back
says
to the
voting in
previous
progress.
question.
Now it's working.
Oh, good.
We just have to present.
Okay.
Looks like we can each vote on 3. Is that right?
Yeah, pick your top 3 and again, look for themes, not statements. Give you guys a few more minutes here. Appreciate your patience with us too, as we learn while we go. How many people do we have total?
14.
14. Okay, we're almost there.
Mhm.
And Phil's driving, so I don't know that we're gonna expect him to vote while he's driving.
Then I think we should be prepared to.
All right, so here are the top answers. So most popular was expansion of Medicaid, outpacing provider recruitment and retention, along with declining reimbursement. Okay, we had 5 people who felt like that was the number 1 response or top 3 response. Public services struggling, such as school districts, increased needs for medical and behavioral health care, underutilization of peer-delivered services, though progress is happening, unhoused community and high medical acuity addiction and needs for more whole person approaches, legislation at state and federal level, workforce transition frequency, growing urban population in Salem had 2. So if we go back up, we've got a lot of votes that had 2, but we've got sort of 3 that really emerged as the top 3. So this expansion of Medicaid, outpacing provider recruitment and retention, along with declining reimbursement. So those things kind of going in the opposite direction. Public services struggling, such as school districts, and increased needs for medical and behavioral health care. Sounds like those are the top 3 driving trends for this group. All right. Okay, so this next one, what events are driving change in the Marion Polk region? And again, here's the definition for events: one-time occurrences. Did we miss factors?
Factors is the 3rd one.
Oh, okay. One-time occurrences such as hospital closure, natural disaster, or passage of new legislation. So what do you see as the major events that are driving change in the Marion Polk region? And again, you can enter multiple events. Someone's feeling creative with a nice metaphor there. Give it just a couple more minutes. All right, so some of the events here, fires, increased presence of PE healthcare, upcoming election, legislation. Here's the metaphor, the tsunami trauma that followed the earthquake, COVID, it's hitting our shores. So increased trauma in the community. Removal of COVID funding early. That's caused a lot of downstream impacts for sure. More legislation, non-compete FTC ruling, gun violence, corporatization of healthcare and consolidation of healthcare entities. Pharmacy closures, schools getting SIAs and pulling mental health providers to no direct care. End of COVID related changes in DEA rules, workforce shortages, Measure 110 changes, increased trauma to the community, and inflation. All right, so we're going to do the same thing. We're going to have you vote on your top 3 as a group, and then we'll share those responses. All right, looks like everyone's voted. Oh, wow. This one was very popular. So the corporatization of healthcare and consolidation of healthcare entities, vertical and horizontal consolidation. That definitely emerged as the top event. Workforce shortages came in second, and the great metaphor of the trauma following COVID coming to our community came in third. Because this was so popular, I wonder if anybody cares to expand on the corporatization of healthcare and consolidation of healthcare entities. I mean, fairly self-explanatory, but anybody want to elaborate on that?
Sure. I threw this up here. I just think it's just an observation that we're seeing across the landscape of healthcare, multiple entities across the spectrum, from hospital considerations to smaller primary care clinics. But this has been something that is happening in hospice, in specialty care, a number of different practices. And so there's some growing evidence, actually some real clear evidence as far as increased spending and costs and downstream effects on patients and the costs for everybody. But seeing it certainly on the impact on workforce too. And I think that's something that people are feeling.
Thanks, Tony. I appreciate that. Carolyn, you came on camera. Did you want to weigh in?
No, sorry, I was just switching from my phone to my computer.
Oh, okay, great.
But, you
Hey.
know, definitely a trend we're seeing across all counties, not just Marion-Polk, and probably more of a trend than an event.
Yeah. Okay. Bruce?
Justin. Yeah, before I go, I was going to say that there are in the Salem area, in fact, I think in the Marion-Polk region, there are only 2 offices of us. I'm one of the 2 that remain that are not owned by groups. As far as children's dental practices go, there's only 2 of us left. Everything else is owned by a larger group.
Yeah. Yeah,
It's happening.
wild. I don't know if anyone else, well, I know Michelle was there because you were a speaker, but recently I went to a breakfast hosted by Salem Health, and they had a panel, and basically the message was from some folks on the panel that the days of having your own small independent practice are over. You're gonna have to join with a larger group if you want to survive in this new world. So that message came through loud and clear. Yeah. Michelle, I don't know if you want to expand on that. Those weren't your words, but you were on the panel.
Yeah, I think those were Bud Pierce's and Dan Sewell's, basically their experience of being in private practice and the challenges. Your margins are getting smaller, your reimbursements, everything. You know, kudos to people who can make it. And if they can make it, hallelujah. But I think it's challenging to be a healthcare provider and a business person this day and age, because it's just not as easy as it used to be.
This is Dr. Hattler, and I wholeheartedly agree with those statements. And I'm at Salem Pediatric Clinic, and we're still an independent practice, but it is getting tougher and tougher. And when we see places like Hope Orthopedics being bought by the hospital, you know, that makes me nervous for our clinic.
I think I might clarify, Hope was not purchased. They asked to become employed, but yes,
Okay.
it was a trend.
Going to say, use that word bought pretty loosely. There's not necessarily a transfer of money when an acquisition occurs.
Yeah. And there's all sorts of different business arrangements that groups can explore, right? So it's not always just a takeover. But certainly we're seeing a lot fewer independent practices making it, and a lot more mergers or partnerships of some sort. So I can definitely attest to that. Workforce shortages, I think we kind of hit on that with the very first question today. So I don't know that we need to go into a lot more detail, but I'm wondering if somebody can expand just a little bit on the increased trauma that we're seeing following COVID. That was a popular response as well. So you all work in different types of settings. What are you seeing?
That was the standard rule of 6 seconds of silence that causes me to speak. So I'm Ryan. What we've seen in at least the behavioral health landscape is an influx of greater acuity related to the trio of ACEs. So adverse community environments, adverse childhood experiences, and there's some research emerging about adverse corporate environments that is causing significant stressors, not only on the workforce, but causing substantial risks to holistic wellness for the community members who access our care. So I think it's prudent to address that. And I do write poetry every morning, so I appreciate your patience with the metaphor.
It's a good metaphor. Thanks, Ryan.
Well, and to be less metaphorical and less eloquent, I think, but you know, the COVID caused a lot of places to shut down, you know, businesses and things. And so, you know, people who were already in the lower socioeconomic stratus, were, becoming homeless houseless at higher rates. We saw increases in substance use and the deaths of despair, and this kind of ripple effect of, the sometimes well, I guess I am going to wax poetic, but that is sometimes I talk to patients about COVID being like a blanket of anxiety and fear that wrapped around the planet, and just kind of the ripple effect of that, but and then layered with the economic effects and all of that. And so we do have these people who were struggling to get by and then went completely underwater. And so we have had an increase in people who needed public health services and social services, at a time when those services became harder to access. And so then their situation spiraled out of control, and so people were just getting worse and worse and worse, and a lot of folks have just not been able to bounce back from that. And so we're still 4 years in now, still seeing higher rates of suicide and deaths from substance use and things like that. So yeah, definitely the effects of that tsunami are still hitting us.
Thank you for sharing. Let's see. Okay. We're on to factors now. So factors are discrete elements such as communities, large ethnic population, an urban setting, or a jurisdiction's proximity to a major waterway. So these are going to be more at the micro level. Think about your top 3 factors or any, actually, this isn't a top one. Let's just come up with a comprehensive list and then we'll vote on top 3 after that. So what are the factors that are driving change in the Marion Polk region? Somehow we managed to put a couple of red lines on the screen.
I know, I was gonna ask where that came
Yeah.
from.
Don't know. Give it a couple more minutes here. All right, feel free to keep writing. I'm just going to start reading through some of these. So employee wellness, network adequacy and closed networks, large rural areas with decreased access to all care. We do have several just service deserts really across the region. Large immigrant population, OARs not developed at the worksite, low healthcare literacy, high agricultural community, affordable housing, provider shortfalls, compartmentalized work sectors, multi-generational housing, not many large companies choosing to be based here. Lack of patient choice, increasingly diverse population of new neighbors, families immigrating, and lack of language and cultural resources, rural community and climate change, heat-related illnesses, smoke and respiratory concerns. Did I interrupt somebody? Was somebody going to say something? Okay. All right, well, same drill. Let's vote on your top three and then discuss it. And again, pick different themes, not just different statements.
Yeah.
Just because I always like it if somebody tells me if I accidentally come off mute, whoever is
Thank
on
you.
as iPhone is on mute or unmuted.
See you here. Oh, I guess that's right. Pseudo Parkinson. Just been sitting in my car listening to this meeting. Okay, I was gonna say, do you want one? I'm just on it on my phone here. If that's okay. Of course, yeah.
iPhone, you are
What was that?
unmuted.
I know this conversators, if you want some or. As I go with the box seat, no, the box seats on the seat. Oh, yeah.
I think you can mute them.
Thank you.
Maybe.
Yeah, that works.
Does the meeting owner have the ability?
Thank you.
I'm trying, but I don't have that capacity.
No, they extended. That's right. I'm like, wait a
Yes,
second.
might have
that
to
takes
mute all.
I don't think I can mute that person. All right, well, let's go through the results.
Sounds good.
All right, these are the top factors that are driving change in the Marion Polk region. Large rural areas with decreased access to all care.
I grew up in a place like, my family was all like, oh, children not very well.
Oh, there we go. I think we got it. Okay. So large rural areas with decreased access to all care. So again, we have lots of resource deserts across the community. Rural community and climate change, heat-related illnesses, smoke and respiratory concerns. And then we've got a bit of a tie here for network adequacy and closed networks, large immigrant population, low healthcare literacy, affordable housing shortage, lack of patient choice for hospital and surgical care. Those are all tied for third. So let's get a little discussion going. So again, this was a very popular one, the large rural areas with decreased access to all care. I'm curious, what's your experience at the clinic level in reaching folks that live in these rural areas, and what are some of those challenges? Why is this such a top one for you?
I think, recruitment's really challenging all over, and it seems to be even more challenging to recruit to the rural areas. We have about, 4 clinics in rural area, and it's always, just challenging to get providers. We have some excellent ones out there, but it's just hard to recruit.
And Michelle, I'm just curious, so even with the challenges getting providers, if you had providers, do you also have challenges getting people to come?
Yeah, we have openings all over and providers tend to choose the more central clinics rather than the rural ones. So it's even within ourselves, we have a hard time getting people to take the rural opportunities.
And then I'm just curious, what about getting patients to show up for visits or to engage in healthcare services in rural areas? Do you see different challenges with patient engagement in rural versus urban?
I do think it's a higher Medicaid population, just social drivers of health are affecting them as well. And then if they have reduced access because we don't have enough appointments for them, there's a little bit of fatalism. Don't necessarily engage in healthcare if we can't meet them where they are.
Yeah, thank you. Thanks for letting me pick on you. Any other thoughts on this one? Danielle?
Transportation is all I was going to say.
And actually, I was going to add to that one. So, same thing. Yeah, I think transportation is an issue. So even with the Medicaid population that can use NEMIT transport, it's a struggle, especially in those rural areas to do that. But also pharmacies. There's been a lot of pharmacy closures. So even if they get to the clinic, they get to see the provider, they can't get access to the medications that they need. And I since I'm a pharmacist, that's mostly what I see, but that's one of the biggest barriers, I think.
Thank you. All right, I'm gonna see if we can maybe coalesce around a third place factor here because we've got so many. So low healthcare literacy, affordable housing shortages, lack of patient choice for hospital and surgical care, network adequacy and closed networks, and large immigrant population. What are your thoughts?
Justin, I'll just say that due to the overlap between network adequacy and closed networks, it's probably prudent to combine that with a large immigrant population because that too is a relevant input for that discussion. And as far as low healthcare literacy, that's undeniable given that some of us with master's degrees or above have spent decades trying to understand what Oregon Administrative Rule actually says, and have found ourselves practicing deep levels of empathy to sit in a place to help clients or patients navigate a very complex healthcare system.
Okay, thanks, Ryan. So you're thinking that the large immigrant population, network adequacy and closed networks could be similar enough to combine? Do you think that would also maybe encompass lack of patient choice for hospital and surgical care?
Yeah, I mean, all of them are interrelated, and I believe that while the overarching theme might be an OAR like 410, 141, 3515, underneath that are those inputs related to immigrant populations and lack of patient choice impacting oftentimes codes of ethics that drive clinical licensure or medical licensure.
Any heartburn with the group if we kind of focus in on network adequacy as it relates to a large influx of population and lack of patient choice for our number 33? I see a thumbs up. Okay. Did you capture that?
Network adequacy.
Yeah.
Yes.
And it'll tie in those other ones as well. Okay, thank you. We're gonna move forward. Yeah.
So for this one, I'm gonna have you guys go ahead and vote as to which of the trends and events and factors that we came across, the top 3 for each. I believe we have 100 points to disperse across the 9 that we came up with. So disperse those points how you would like across the list that we've come up with, and from there, we're gonna get our top 3 impacts that are affecting the Marion and Polk communities in your guys' opinions. And from there, we'll have further discussions on what that may look like or what that might mean. So
So basically,
we
you've got 100% to work with and allocate those percentage points wherever you see the biggest issues or opportunities.
this one does take a bit
Mhm.
longer.
And remind me when they're done, don't they have to push a button?
When they're done, yeah, it'll click submit.
Okay, so when you've allocated your percentage points, hit submit at the bottom of your screen. There we go.
So I think right now we're only having
All right, we're at 12 people who have submitted. It looks like the clear front runner is workforce shortages. Oh, I take it back. It's no longer the clear front runner. Now we're at 14 and we've got a tie between workforce shortages and increased need for medical and behavioral health care. Those are definitely related. Expansion of Medicaid, outpacing recruitment and retention. And then the issue we talked about around consolidation of healthcare entities as the top 4 issues there. Coming in right under that would be public services struggling, for example, school districts, and then trauma that followed COVID coming in after that. So these are things that are going to be incorporated into our community health assessment as the biggest forces of change impacting our healthcare community across Marion and Polk. I think this is super important because this is going to lead to our priority areas for us to focus on for the next 5 years under our community health assessment. It's also going to drive our community health improvement plan. And that community health improvement plan, I'm sure you guys have received several overviews of that over the years as part of the clinical advisory panel and probably in other settings. But for the Health Council, what that means is that most of our policy work and our funding goes toward initiatives and strategies that are tied to our region's community health improvement plan. So this is all super important work that's ultimately going to lead to major investments in healthcare and policy initiatives across the region. Anybody have anything that they want to add to the increased need for medical and behavioral health care, workforce shortages, or expansion of Medicaid outpacing recruitment and retention? Does that all seem to resonate pretty well with your priorities as a group?
All 3 of them are to me, the same thing. We just don't have enough, we're struggling with workforce.
Yep.
So the top 3 are kind of reiterating themselves.
Okay, thanks, Michelle. Yeah, Alexia had a good point. Would we want to use as a number 3, the consolidation of healthcare entities as that third? I guess it's a tie for second place, really. So because 1, 2, and 3 on the screen there are kind of all related, maybe we look at corporatization of healthcare, consolidation of healthcare entities as a top priority as well? Or a top force? Okay. All right. Anything else you want to add to this? I see some thumbs up. I think this is just going to walk us through what we just talked about.
This is gonna ask, so this is what it looks like on the right. They're gonna put in equity impacts
Oh.
and opportunities created by this.
You want to tell me?
Yeah, so if you guys are on your phones or on your computers, it's gonna ask what your equity impacts and threats posed and opportunities created by this specific factor. But if we could also make sure that we're doing this verbally so that we're able to capture what everyone has to say, since I know 140 words and characters isn't necessarily a lot of room. But from there, what could possibly be possible to equity impacts from the increased need for medical and behavioral health care? What are threats posed to specific communities or something along those lines? And then opportunities that could possibly be created, whether that be opportunities for improvement, or anything along those lines.
Great. Thanks, Alexia.
Mhm.
And so we'll do this for the top three.
Mhm.
Perfect.
Here rather than the expansion of Medicaid outpatient recruitment retention? Or did we want to use the expansion as our third one? Our top three were increased need for medical workforce shortage.
I think you could probably collapse those first two.
Collapse those first two. Okay, then we'll use the expansion as the second one.
I can't see anything on my end, so.
Just wait for them. This is what it looks like. Submit.
For the next one. Yeah, this one doesn't show.
Yeah. Maybe have them do the little thumbs up so that we know.
Yeah, if you could hit your thumbs up when you're done. Thanks, Dr. Hattler. Appreciate you being here today. I know this one's going a little bit longer today. I think we had a longer time scheduled, and I'm sure for practicing clinicians, that's tough. So appreciate you being here. Hit the thumbs up when you're done with this section, and then we'll move on. All right, and I don't think on this one we have a way to show this on the screen. So if anybody has anything they want to add, whether it's an equity impact or an opportunity or a threat to this particular force of change, come off mute and share your thoughts. I think we've talked about it quite a bit, though. Any other particular equity lens or anything that you want captured in the official notes? Okay.
This is Manu. I'm not certain if this. I actually am pretty certain it won't go here, but while I appreciate this very much, and it's nice to know that oral health is not considered to be a grave concern in the community. We do know that in 2025 there will be an expansion of the WISHN category, which is, and I'm going to butcher the acronym, but essentially it's for youth with special care needs, or essentially the IDD population, it's going to expand up to age 26 for all care that's medically and dentally necessary. And so, while we are largely going through and discussing overarching components, I think we should also keep in mind the members that could be most disadvantaged by changes to the benefit package. And so I'm not exactly sure where that would go, but I just wanted to provide that as some additional context coming over in 25.
Yeah, thanks, Manu. I appreciate that. And that could probably live in a couple of different places, right? We've also got an expanded Medicaid population where it's tough to keep up with the provider levels that we need to see that expanded population. And then at the same time, we've got an expanding Medicaid benefit. So we've got to make sure we have new types of access for the Medicaid population. And that could be oral health, it could be medical, it could be behavioral health. It could also be social determinants of health. It could be social emotional health. So we've got new benefits rolling out as well as an expanded population at a time where we have a lot of challenges just meeting basic healthcare needs. So hopefully I didn't summarize your thoughts too much there, but I definitely see the need to add oral health in here as well.
I really appreciate that, Justin. I feel as though that my suggestion, I was kind of back down to the 10,000 foot level, and you brought it back up to the 100,000 foot level. So thank you for summarizing and considering my concerns.
All right. I'm going to move us on to the next one. We've got some folks dropping, and I want to make sure that we have an opportunity to get through the whole exercise here. Whoops, wrong button. So I think we just kind of hit on this again, but if anybody has anything else they want to add, put it in in your phone, in those text boxes. We'll capture it that way in the document, and then we can spend a couple minutes talking about it too. So again, any kind of equity impacts, any kinds of threats, any kind of opportunities that we see with the Medicaid expansion, outpacing recruitment and retention. Probably lots of equity impacts there. All right, anybody want to share equity impacts, threats, opportunities related to expansion of Medicaid outpacing recruitment and retention? Well, if not, I'm going to share one. I think one of the opportunities is to look at some, I guess, new and old innovations in our system, use of traditional health workers to reach new populations. So I think that there's a lot of opportunity for innovative care models to reach the Medicaid expansion population. Certainly a lot of threats, given all of the workforce challenges that we talked about earlier today. And just a whole host of potential equity impacts looking at meeting people in more culturally and linguistically appropriate ways. So those are just my thoughts. Ryan?
I just want to echo that, Justin. I think part of the Knife decision-making framework is using chaos as an opportunity to create novel practices. Simply put, this is an opportunity to bring up the utilization of traditionally underutilized workforce and licensure and certification, such as the case of THWs, peer delivered services, PROs. It creates a unique opportunity to truly allow our workforce to deliver services at the top of their licensure. So seconded strongly, Justin.
Thanks, Ryan. Any other thoughts on this one? Okay, again, we've got your comments captured on the back end here. Move to this last one. We had a pretty healthy discussion about this earlier, so maybe find a few words to put in those text boxes so we can capture your words for the exercise. Really looking at the consolidation of healthcare entities and the impact that has on the community. What kind of equity impact does that have? What kind of opportunities does that create? And how does that threaten our community?
Justin, this is Danielle. I don't know if it's just me, but it didn't update in the slides to enter that information in.
Uh-oh. It's showing on our end. Anybody else having a tough time entering this one? Ryan, are you able to do it? Yep. Okay.
Perfect. I reloaded. I'm good.
Okay. All right. Because my tech skills stop at unplug it and plug it back in.
If it helps, that's pretty much where mine is too. Turn it off and turn it back
Yeah,
on.
that's right. Be amazed at how often that works.
Yeah, honestly. It's probably why I've never tried to learn further than that.
All right, well, as you're finishing up, anybody want to comment on equity implications, opportunities, threats? Something that we didn't touch on earlier? You know, there's probably a lot of opportunities in getting bigger and having more resources available to serve the community at a larger organization scale. There's probably a lot of considerations too about losing that that trust, that relationship, that rapport between patients and providers. There might be equity implications related to large DEI opportunities within large scale organizations. There could also be a loss of some equity considerations in going from a small independent practice up to a large organization. So I think that there's probably lots of different considerations for all three of these categories. Anybody else want to weigh in on that? All right. Well, no pressure.
Just
Oh, go
Justin,
ahead.
this is Danielle.
Yeah.
I just have to jump in because I'm a part of the Independent Providers Association. So I think, you know, there are still quite a few independent providers in the area, and they're working on doing it right. And I think as the IPA continuing to focus on ways to continue to support and improve support for people to stay independent if they wish to stay independent providers. There's a lot going uphill on that, but as a clinical pharmacist and being able to support providers clinically in those clinical decision-making versus the value-based payment reimbursements. There's some big balances there. And I think that they can still practice independently, but still have some of that higher level large corporation support-ish that a lot of the other larger groups that are like the Salem Health or CNEM hospital groups do still have with that. So just my 2 cents in the IPA.
Yeah, thanks, Danielle. I think the IPA does present a good opportunity to support those independent practices and still take part in kind of a community health approach, and probably looking at some of those corporate level advantages that you might see with some of the larger organizations. So thanks for calling that out. I think that is an important part of this conversation. Any other thoughts on this one before we move forward? Okay. So this last one, this is the end of your journey with this exercise today. What was your main takeaway from this discussion today? And so this is just your opportunity. I think it'll do another one of the collage or what do you call it?
Brainstorm.
Brainstorm on the screen. So what was your main takeaway from today? Oh, and when you've entered your word, hit submit, and then it'll populate on the screen. So definitely need more staff. SWOT equals innovation. Love it. Thanks for having behavioral health join the conversation. Collaboration, being able to increase access to care for rural and underserved communities. Appreciated inclusion and equitable process. Any other parting thoughts? Okay, well, as we're wrapping up again, thank you very much. Appreciate everybody's time today. This won't be the end of this conversation. Again, this is a super important part of the community health assessment. That community health assessment is going to lead to our community health improvement plan. And that plan is going to drive policy discussions as well as a lot of funding that's going to pour into the community to support initiatives related to that CHIP. So thank you again for doing this today. Appreciate it. And this will result in action, which is what we're trying to be all about. There we go. Thank you for sharing your perspective. I think Bruce is probably seeing patients right now and maybe just left his phone on. But this is going to wrap up today's meeting. So we'll have a regular CAP meeting again without a survey like this next time. And I think we're probably looking at bringing back some of the shared savings recommendations to the next CAP meeting. So stay tuned for that, and everybody have a great rest of your day. Thank you.
Thanks, Justin.